Today I have the privilege of finding out more from Dr. Patricia Boardbar, a highly trained specialist in oral and maxillofacial surgery. So let's start with the basics. Wisdom teeth. What are they?
Wisdom teeth are the last molars at the back of the mouth. Most people have four, one set at the top and one set at the bottom. They're the last teeth to erupt, usually making an appearance in the late teenage years. The problem is there often isn't enough room for these teeth to erupt normally and become fully functional teeth, so they become what we call impacted. That is, they will either fully or partially be covered by gum and often push towards the neighbouring teeth. It can be difficult to clean the area around an impacted wisdom tooth, and this is why they can become decayed or infected or even cause damage to the neighbouring teeth. These are some of the reasons why we remove them.
Is there an ideal time to perform this surgery?
The best time is earlier rather than later in the patient's oral development, preferably before the age of 25. But naturally, they can be removed at any age if they become problematic.
I remember having an anaesthetic to have mine removed, but friends have boasted about being awake during the procedure.
Yes, it does vary, but during the consultation, a specialist oral and maxillofacial surgeon will advise patients regarding the most appropriate form of anaesthesia for the removal of their wisdom teeth.
And why do some people have their wisdom teeth removed by their general dentist while others go see the specialist like yourself?
In the past, if the extractions were expected to be straightforward, it was common for their general dentist to perform the procedure. But these days, many dentists will refer you to a registered specialist oral and maxillofacial surgeon, especially if you wish to be fully anaesthetised or if your extractions are expected to be more complex. Here at Smile Solutions, we make that referral totally seamless because we all work together in the one location.
I suppose there are the usual risks that doctors always tell their patients about, so it makes sense to be in the hands of the most highly qualified practitioner available.
That's right. As oral and maxillofacial surgeons, not only are we fully qualified and registered dentists, but we're also fully qualified and registered medical doctors who have carried out additional specialist surgical training in a hospital-based setting, just like any other surgeon in the medical field, so our patients can be reassured that they are being treated by the experts in this field.
Then you've already had a fair bit of hands-on experience in hospitals before you extract a single wisdom tooth years down the track.
Absolutely.
Thanks for your time, Patricia. It's been great to find out more about your specialty.
My pleasure.